Normal labor scenario, stages and management. Nurse Sarah, the attending nurse. Dr. Roberts, the obstetrician. Emily, the laboring patient. John, Emily's partner. Nurse Rachel, assisting nurse. Anesthesiologist Dr. Carter. Babies cry in the background when the baby is born. The scene opens in a hospital delivery room. Emily is sitting on a bed, looking a bit uncomfortable. Nurse Sarah enters, holding a clipboard. Nurse Sarah, smiling. Hi, Emily, how are you feeling? Any changes? Emily, breathing through a contraction. It's getting stronger. I think this is it. Nurse Sarah, all right, let's check your progress. She checks the patient's vitals and palpates the abdomen. You're in the early stage of labor. Your cervix is about 3 centimeters dilated. We'll monitor you closely. How's your pain? Emily, it's bearable right now, just a lot of pressure. Nurse Sarah, that's normal for early labor. It's still a bit early for pain relief, but we'll make sure you're comfortable. Do you want to try moving around a bit? Walking, or perhaps using a birthing ball? Emily, maybe walking will help. Nurse Sarah, great idea. Walking can help with progression. I'll be right outside if you need me. I'll also start an IV for fluids, just in case. Emily and John leave the bed and start walking around the room, focusing on breathing through contractions. Later, Emily is now lying back in the bed. She's sweating, breathing heavily, and looks visibly more tired. Nurse Rachel is monitoring her vitals. Nurse Rachel, calmly. Emily, we're now in active labor. You're about 5 centimeters dilated and your contractions are coming every 3-4 minutes. We're making good progress. Emily moaning, I don't know if I can do this anymore. John holds Emily's hand, showing support during labor. Nurse Rachel is gently encouraging Emily, who is in labor, to focus on her breathing. The scene is warm and supportive, with soft lighting and an atmosphere of calmness. Emily is seen breathing through a contraction, her expression a mix of determination and discomfort. The nurse stands beside her, ready to offer support. The nurse offers options for pain relief, showing empathy and understanding. Emily contemplates her choices, looking reassured by the nurse's presence. Emily, gasping, can I have something for the pain? This is getting tough. Nurse Rachel, absolutely. She speaks to Dr. Roberts on the phone. Dr. Roberts, Emily's asking for pain relief. Shall we consider an epidural? Dr. Roberts, over the phone. Yes, if she's ready, I'll have the anesthesiologist come by. Let's continue to monitor her and check dilation in about an hour. The anesthesiologist, Dr. Carter, enters and prepares for the epidural, while Nurse Rachel continues to support Emily. Emily is now visibly exhausted and feeling intense pressure as she nears full dilation. Dr. Roberts enters the room looking over the charts. Dr. Roberts checking the cervix of a laboring woman named Emily. You're almost fully dilated, Emily. Just a couple more centimeters. You're doing fantastic. Emily, breathing heavily, holding John's hand. I can't keep doing this. It's too much. Dr. Roberts, you're so close, Emily. The urge to push might start soon. I know it feels overwhelming, but we'll be here with you every step of the way. Let's try some focused breathing. Nurse Sarah, gently. Focus on your breathing. Big, deep breaths in and out. Your body is preparing for the pushing stage, and soon we'll start helping you through that. Emily, whimpering. I feel like I need to push already. Dr. Roberts, that's a good sign. We'll do a quick check to see if you're ready to push. Dr. Roberts checks again. Dr. Roberts, you're fully dilated. It's time, Emily. Let's get you ready for pushing. Emily is in a more upright position in the bed, with her knees bent and her feet in stirrups. John is at her side, holding her hand. Nurse Sarah stands at the end of the bed, ready to assist with delivery. Dr. Roberts, calmly. All right, Emily. When the next contraction comes, I want you to push. Push as if you're having a big bowel movement, but focus all that energy down. Ready? Emily, nodding, breathing deeply. I'm ready. Dr. Roberts, guiding her. Okay, now deep breath and push, 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 push. Good job. Keep going, Emily. One more push. Emily pushes with all her might, sweat beading on her forehead. The baby's head begins to emerge. Nurse Sarah, encouraging. Great job, Emily. The head is almost out, just a little more. Emily, panting. I can't do it. Please help me. Dr. Roberts, you're almost there. One more strong push, Emily. We can do this together. After a few more pushes, the baby's head is delivered. Dr. Robert, with excitement. Here we go, Emily. Just one more push to bring your baby into the world. Push. Emily pushes again, and the baby is fully delivered. There is a brief pause. Baby's cry, loud and clear. Dr. Roberts, smiling. Congratulations, Emily, you did it. It's a beautiful baby boy. Emily is breathing heavily but smiling, tears in her eyes as she looks at her newborn. Nurse Sarah places the baby on Emily's chest for skin-to-skin contact. Nurse Sarah, gently, here's your baby, Emily. Take a moment, breathe and bond. Your baby's doing great. Emily, tears in her eyes. Oh my God, he's perfect. I can't believe it. Dr. Roberts, now we'll need to deliver the placenta. Emily, just a couple more pushes and we'll be finished with the active part of labor. Emily gently pushes and the placenta is delivered. Dr. Roberts, the placenta's delivered and everything looks great. We're going to monitor your bleeding and we'll start your recovery process. Nurse Rachel, checking Emily's vitals. All vitals are stable and your baby is doing wonderfully. Let's get you settled for some rest now. Emily is resting, holding her baby on her chest. John is by her side, looking at their newborn with awe. Nurse Sarah is helping with initial assessments of the baby. Nurse Sarah, smiling. Your baby looks good. We'll do a quick check, temperature, weight, and the first bath if you're comfortable with that. Emily, gazing at the baby. I can't believe he's here. Thank you both so much. Dr. Roberts, smiling. You did great, Emily. We'll leave you to bond with your baby. If you need anything, we're right outside. The camera fades as Emily, John, and their newborn settle into their first moments together, the team quietly exiting the room. Normal labor scenario, stages and management.